While the arrival of vaccines and the rollout process is a critical part of sort of turning the corner on COVID, I can't state how important it is for everybody to maintain their diligence and their vigilance as we move through this particular part of the process. We've talked on a number of occasions about our concerns associated with the holidays. Thanksgiving certainly turned out to be a pretty significant hit to our healthcare system and to our Commonwealth with respect to the rise in cases and hospitalizations that came after that. It's still a little early to draw broad conclusions about the post-Christmas and New Year's impact, but we certainly believe, based on everything that we've heard from our conversations with our colleagues in the hospital world, that there has been a tick up in hospitalizations after the beginning of that particular week, and we're obviously going to pay a lot of attention to that data over the course of the next few days. I will say this. In the beginning of November, the average age of a hospitalized patient in Massachusetts was about 61 who was hospitalized for COVID. The average age of that population today is 73. And I've talked to people in the healthcare world who've basically said that they watched that intergenerational transfer take place based on the people who were coming into their institution after Thanksgiving. And I think in many ways that speaks to why it's so important for people, if you're with folks outside your immediate household, you really do need to take precautions. Even if you're in informal settings, you really need to wear a mask. If you do feel sick, you need to get tested. It's really important that you not engage in a lot of the informal types of activities and gatherings that we're also familiar with, at least until we get through the rest of the rollout on this vaccine. And I know for everybody, this has been a really rough and difficult and complicated period of time. But now that we are to the point where we are able to start vaccinating people and rolling out and rolling up our vaccination program here in the Commonwealth, it's critically important for people to continue to do the things that keep you safe. You know, wearing a mask, maintaining your distance, maintaining good hygiene, and really trying to avoid a lot of those informal gatherings where people have a tendency to let down their guard, because it's very clear to a lot of the folks in the provider community that they watched what happened to the folks that were coming into their institutions after Thanksgiving and saw that intergenerational transfer of COVID, which probably took place around the kitchen tables and dining room tables that so many of us frequent during those holiday seasons.